Hello, everyone. Can you hear me okay? Drop it in the chat if everything's working. Awesome, perfect. Well, thank you all for joining us. Welcome to FURst Aid, Pet Triage and CPR for Dogs and Cats, presented by the Oregon State University Carlson College of Veterinary Medicine. It's so great to have you all today. As you can see in the chat, we have animal lovers from all over the country online with us right now. They include pet owners, veterinary technicians, and veterinarians. So again, thank you and welcome for joining us. My name is Jens Odegaard. I'm the Director of Marketing and Communications here at the Carlson College of Veterinary Medicine. Our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public. We have 331 students here in the college. 300 are studying for their doctorates of veterinary medicine, and 31 are graduate students in our comparative health sciences program. The college serves the public with research and direct clinical and diagnostic services through the Lois Bates Atchison Veterinary Teaching Hospital and the Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for today's presentation. At the bottom of your screen is a Q&A box, and you can put your questions in there throughout the talk. We'll try not to answer them during the presentation, but we'll get to as many as we can after the presentation concludes. Also, there's the chat function, which you're all using, so feel free to drop things in there as well. I'd now like to present today's speaker. Dr. Tandi Ngwenyama is a clinical assistant professor and a specialist in small animal veterinary emergency and critical care. As a clinician in the emergency and ICU setting, her team provides comprehensive care for patients with acute and chronic life-threatening conditions. They perform a patient-centered clinical assessment and establish a management plan for each patient. They elicit a history, perform a clinically relevant focused physical exam, select appropriate diagnostic testing, and interpret the results for the purpose of diagnosis and therapeutic management, disease prevention, and patient advocacy. Procedures or therapies are prioritized, taking into account clinical urgency and available resources. As a clinician educator, the majority of Dr. Wanyama's teaching efforts are on the clinic floor, where she must balance the supervision of clinical care and teaching. In this clinical teaching setting, she is often engaged in a dual process of problem solving: clinical reasoning to care for patients and educational reasoning to teach students and trainees. She hopes to create a learning environment in which students feel safe, seen, heard, valued, and respected. So Dr. Wanyama, over to you.
Thank you, Jens. Such a great introduction, and greetings from the Leilani Comfort Room. I'm Dr. Tandi Ngwenyama, and I just want to introduce my assistant. Come on, Shoba, don't be shy. There you go. So this is Shoba, and so you'll see in my presentation, she helped me out with a lot of the videos, and then she'll also be here if you need any sort of real-time demonstrations of any of the procedures. But why don't we go ahead and get started and start learning? Jens, do you mind queuing up my presentation? And so this presentation is designed to prepare you to intervene if your pet suddenly collapses or becomes unresponsive. And my hope at the end of this presentation is that you can better support your pet and get them to the nearest veterinarian. And so I want this to be an inclusive presentation and geared towards all pet lovers, whether you have a lot of contact with pets on a daily basis, like a dog walker, dog groomers, dog care providers, or just own pets, or actually belong in the veterinary field. And so all are welcome. I'm hoping by the end of this presentation, again, you'll feel more comfortable in assessing your pet if he or she should collapse. Additionally, how to diagnose cardiopulmonary arrest, which is a condition in which the pet stops breathing and the heart stops. also how to initiate CPR or cardiopulmonary resuscitation on your way to the nearest veterinarian. Next slide. First things first, knowing what's normal in your pet. So being able to get a sense of what baseline is for them. And in the subsequent slides, I'm going to teach you how to acquire those vital parameters, such as your heart rate, respiratory rate, what does the pulse quality feel like. We're going to learn about what we call capillary refill time, or CRT, which can give us an idea of blood flow. Ideally, collecting sort of those baseline values so you know what normal is for your pet. And anytime there's an acute change, you'll be able to pick it up sooner rather than later. Preparedness is really important, and being, ready for any eventuality. And so having a first aid kit available can be very helpful. And in that first aid kit, having important contact information, as well as I would recommend programming it into your phone. And helpful numbers include your pet's veterinarian, as well as the closest local ER clinic, and also knowing the number for the Animal Poison Control Center. Putting together a pet first aid kit is also helpful. And a lot of the materials are very similar to what you might have in your family's first aid kit. So some things that I would include would be like a digital thermometer, a muzzle, a spare leash, having gauze roll, as well as clean towels, and then some adhesive tape, an eyedropper as well too. We are going to put in the chat a brochure that has sort of a checklist of all of those items that we recommend being included. Next slide. Okay, so what are some normal vitals for your pet? And you can see here there are some species differences between dogs and cats. And typically there's a range. So heart rate for a dog ranges from about 60 to about 160. There can be some differences if it's a pediatric patient, which I consider less than about 6 months. They tend to have a little bit higher heart rate, so they'll be on the upper end. Also, if you have very fit dogs or very athletic, then their heart rate, resting heart rate might be a little bit lower. Our feline pets also have a range as well too. So normal can range from as low as 110 to as high as 180. In the hospital setting though, we're used to a little bit higher heart rates. Cats can get a little stressed in the clinic, and so typically we see more like 160. Respiratory rates vary from about 10 to 30, and this is resting respiratory rate, so not after they've done any sort of activity. And then also trying to differentiate panting in dogs, because that's how they dissipate heat, and it can be as high as 200 when these pets pant, but typically the difference because their mouth is opened and their tongue is out. Moving on to mucous membrane color. So we tend to look at the gums and the cheeks of animals. If you have a pet that has pigmented gums, then you can also look at the prepuce, for instance, or the vulva, or some other locations that you can look at those mucous membranes. And typically they should be pink. And that's because, we have good blood supply that's going to the surface there. And so you're able to visualize that. And so because of those red blood cells, it reflects light, and then you see that sort of pinkish color. Capillary refill time. So if you guys take your thumb and you apply digital pressure and blanch it and then remove your finger, you'll see it turns white, and then as it refills with blood, it'll return to being a pinkish color. So in people, that's how we do the capillary refill time. And in animals, probably a better location is in the gums or the cheek. And so you push on their gums and blanch it. And again, normal should be about 1 to 2 seconds. If you're able to take rectal temperature, And I recommend getting one of those digital thermometers from the grocery store, and you can use some sort of lubricant. It could be Vaseline or some water-based lubricant. And we typically will take a rectal exam in dogs and cats. And they run a little bit higher than we do. So they range from about 99.5 to about 102.5. Cats can be a little bit warmer than dogs can. And we consider high temperature fever greater than 103. If your pet's not amenable to doing a rectal temperature, and I know Shumba's not a real big fan, you could try to do an axillary temperature. Don't put the thermometer in their mouth because they'll likely bite it. But an axillary temperature will probably add a degree or so. And so that can give us an idea of body temperature. Next slide, please. Okay, so how do we check your pet's heart rate? So I would say the best way that you can do that is the point where the left elbow touches the side of the chest. And I find it easier on the left side. That's typically the point of maximal intensity. And so if you pull up their elbow about a third of the way up the chest, that's like the perfect location, about the fifth intercostal space. And, you know, what we tend to do is feel how many beats, and we'll record it over 15 seconds, for instance, and then multiply by 4. And that gives us an idea of number of beats per minute. You could also feel their pulse rate too, and you can try to feel their pulse and the heartbeat at the same time, and they should be fairly synchronous. Next slide. And so to check your pet's pulse, gently place your middle and index finger to the inner thigh. And you can place your 2 fingers as high up as possible on the inside of either leg. So it's where the leg meets the body wall. And then you feel for a recess in the middle of the leg, and it's approximately halfway between the front and the back. And just like you counted the heartbeats, it would be the same thing. Feel how many pulses against your finger in 15 seconds, and then multiply by 4. You can also get a sense of what feels normal for your pet. So if you take your hand and then you take your finger and you tap your finger on your hand, that's about what the pulse should feel like. When they're really strong or bounding pulses, it almost feels like you're flicking your finger against your hand. And then, you know, some abnormal pulses are if it feels really weak and thready, and so you're having a hard time, you know, feeling it. I will say it can be a little bit tricky, so definitely practice with your pet. If they're a little bit heavier, it can be more difficult to feel their pulse. Next slide. Okay, so how do you assess your pet's breathing rate? And so, you know, typically you want to watch your pet and count the number of times the chest rises and falls in 1 minute. So you can do it for a whole minute, or again, do it for 15 seconds and then multiply by 4. And they should be resting ideally, you know, in lateral recumbency on their side, or even if they're sleeping. So that's a good time to monitor their respiratory rate. And you really shouldn't see very much abdominal component to it. If you're noticing a significant abdominal push, it could indicate that you might have some underlying respiratory disease. And like I mentioned before, a little bit tricky with dogs, because when they're panting, they're just moving a lot of dead space air. So it's not really going from their lungs. And they're trying to, through evaporative cooling, try to cool themselves. The way that you can tell that they're panting is typically their mouth is open, and then also their tongue is out. Next slide. Next, looking at mucous membrane color. So if you look at the figure right in the middle, that's a normal pinkish hue that we would expect in our pets. So we would say that's normal mucous membrane color. If you look in your top right corner, those are hyperemic mucous membranes, so kind of a brick red. And we can see it when our pets are really, overheated. We can also see it if they're sick. And for instance, have things like, allergic reactions or anaphylaxis. We can also see it when they have serious underlying diseases like sepsis. There can be some breed variation. So, as much as possible, again, look at your pet and see what normal is. And know that some pets may be a little bit pigmented. Going in, on your bottom right, you can see that these are sort of bluish mucous membranes. They have a bluish tinge to them, and we call them cyanotic. This is a really serious finding in our pets, and it typically means that there's not enough oxygen in the blood and they have hypoxemia. It tends to be a finding when they have severe respiratory disease. So certainly if you see that, seeking veterinary care is important. Next, bottom left, you can see these really yellow, almost highlighter yellow mucous membranes, what we call icterus in veterinary medicine, and they call it jaundice in human medicine. Also not a good color. And typically we think of either something wrong with the liver, or we can see in dogs a disease called immune-mediated hemolytic anemia, where they destroy their red blood cells and basically spew the contents into the vasculature. And then top left, you can see white mucous membranes, which we can see in patients that are very anemic. So they don't have a lot of red blood cells or oxygen carrying capacity. They tend to be very lethargic and weak, have exercise intolerance, and it could be that they're bleeding somewhere, and that's the cause of them having white mucous membranes. So again, just to give you a range of the different colors that we can see with mucous membranes. Next slide. Some important triage questions that your vet may ask you when you're deciding whether to bring your pet in on emergency, or even I think questions to ask yourself in your own head when you're trying to figure out, again, what could be wrong with my pet. And this is really vital information for us so that we can get an idea of what might be going on with your specific pet. And I, in essence, think it's, it's kind of the story of your pet, both, what's going on in the past, and then also what's going on in the specific, present context. So signalment just means the age, the breed, and the sex. And it helps us to, in essence, stereotype some patients because there's certain diseases that they're more predisposed for. Your vet will often ask you what the primary concern is or the chief complaint, and then what the current signs are that you're seeing. To give us some background or context, knowing about pre-existing illnesses and what medications your pet is on, it may be helpful to bring those medications into the vet so that we can actually see the doses. Is there any known or suspected toxin ingestion? So do you have anything in the house that they might have gotten into as well as outside? A lot of the toxins that are toxic to people are also can cause some toxicity to our pets as well too. But there are also some mundane things in the home, like grapes and raisins can be toxic to our pets, chocolate as well too, macadamia nuts, some of those seemingly innocuous substances. Any current medical condition. And then they may ask specific questions to get us an assessment of, is this something that is life-threatening? Should you come into the clinic right away? Are they able to breathe easily? Are they acting normally? Is there any recent trauma? Next slide. All right, so some definitions. Cardiopulmonary arrest means that an animal's heart has stopped beating and has stopped breathing. And because blood flow and delivery of nutrients to the body have ceased, the animal quickly loses consciousness and then becomes unresponsive. So CPA, which stands for cardiopulmonary arrest, is a serious life-threatening medical emergency. And it's something that potentially could be reversible, but left unchecked or untreated will always lead to death unless a patient is aggressively treated. As far as causes of CPA, next slide, can be caused by a myriad of different things. Some of the more common things that we see are trauma, especially vehicular trauma, toxins, like I mentioned before, choking. So let's say they get a rawhide or a toy. I remember I had a patient, a cat that, and cats love linear things. And so it was around Christmas time and was playing with some of the Christmas ornaments and then ingested the string, and the ornament got caught in the back of the throat and blocked its airway. The good thing is they were able to bring it into the clinic and we did an emergency tracheostomy so we could bypass the blockage and allow the pet to breathe and then be able to remove the toy. So not an uncommon thing. There can be a lot of choking hazards in the home. Having breathing problems, allergic reactions are not uncommon, and you can have a range from very mild to more severe life-threatening, like such as anaphylaxis, where they have cardiorespiratory collapse. Heart emergencies, seizures, bleeding. With large breed dogs, we worry about them bloating and then torsing their stomach. Typically, they need emergency surgery for that. Exposure to the elements, especially extremes of temperature, both hyperthermia and heat stroke, but also hypothermia. Obstruction of the airway. Certain breeds of dogs are more prone to obstruction, such as your smushed-faced animals called brachiocephalic. And that includes your bulldogs, your French bulldogs, just to name a few. Heart disease, lung disease, just many other chronic and acute diseases. So kind of a myriad of different causes of cardiopulmonary arrest. Next slide. I think it's important to know, what's happening during cardiopulmonary arrest from a physiology standpoint. So it affects your heart, and your heart is really important for pumping, and it drives blood through your circulation, typically oxygen-rich blood from the lungs to other organs to provide energy and nutrients. And then you need your lungs as well too, because that's where gas exchange happens. So you're able to uptake oxygen and then be able to expel the waste product of carbon dioxide. So you need to have both heart and lung function in order to live. So one of the goals of doing CPR is we're almost acting like the heart and the lungs. So with our compressions, we're acting like the heart to drive and push and circulate blood flow. And when we do ventilation, we're acting like the lungs again to blow in oxygen and then also expel carbon dioxide. So really, really vital function. Next, we're going to talk about how we actually do CPR. Next slide. I wanted to share with you this PET CPR algorithm, and it was put together by the Recover Initiative. And Recover is an acronym that stands for a reassessment campaign for veterinary resuscitation. And it consisted of a large group of experts in emergency and critical care who combed through the literature to find the best evidence and put together a compiled a set of clinical guidelines for us to follow in the veterinary field, as well as for pet owners. And I always think it's very helpful when one has a memory aid, because in the moment it's very stressful. stressful, right? Your pet is not doing well. Many things are going through your head. And so remembering what the different steps are can be really difficult in such a crisis situation. I think the nice thing again about having an algorithm and one that you've also practiced is then it just becomes innate or intuitive. So in these, stressful situations where you don't have a lot of extra cognition that you can respond appropriately. I'm going to go through each of these in more detail, but I just wanted to give you an overview of this. And at the end, I provided resources so that you could actually become certified in CPR. And it's through the Recover organization. So they provide online modules. I think it's about $35 for the online modules. And then you can also do some in-person simulation training so that you can be certified. So hopefully this will be a springboard for you to go to this next step. But the different steps, that are involved is identifying that a patient is, unresponsive and not breathing. And so you want to determine if that patient is actually experiencing cardiopulmonary arrest. Immediately, then you want to call for help because you're going to need someone to help you transport the pet to an emergency facility, as well as potentially take turns doing chest compressions because it can be really tiring. Probably most important and why it's highlighted in red is the actual approach to doing CPR and the components of chest compression, which is probably one of the most vital things, as well as giving breaths, which we do mouth to snout. And it's going to be a cycle that's repeated every 2 minutes. And it's been shown that if you give high quality CPR, typically consisting of, appropriate high quality chest compressions, and you have minimal interruptions, the more likely you are to have a successful outcome. And then with the next step being to load the pet, continue CPR in the car while you drive to the veterinarian. All right, so let's talk about each of those in a little bit more detail. Next slide. So again, sort of highlighting what I mentioned before, determining if the pet has experienced cardiopulmonary arrest, calling for help, administering CPR, and then transporting your pet to your vet. Next slide. So how do you know that your pet is in cardiopulmonary arrest? There's 3 steps that are recommended. The first is to stimulate your pet and see if they'll actually respond. And so you can do that by shaking your pet, calling his or her name loudly, and look for any signs of response. And remember that you're trying to make sure that your pet is able to respond. So stimulate him vigorously and look for those signs. However, if he's still not acting normally, you should still get him to the closest local open vet clinic if he is somewhat responsive, but again, you think it's inappropriate. Next step is to determine if your pet is breathing. So you want to look closely at the chest and see if it's moving. Placing your hand on their chest can also help to feel if you're feeling any chest exertion. And then next, checking the airway. And I'm going to show you how we do it in Shumba, but basically you want to pinch the sides of the cheek and then using your other hand, usually I use my index finger, and then right between their canines and the incisors, you can depress their lower jaw and then you can look in. Depending on if the patient's awake or not, then you can put your hand in their mouth. If they are awake, be careful because you could get bitten during this. And then ideally, this should only take about 10 to 15 seconds. If at the end of this assessment, you're still not sure if they're in cardiopulmonary arrest or not, go ahead and initiate CPR. There's very minimal harm that you're going to cause a pet, even if it's not in CPA. Next slide. So you can see in this video here, I have my assistant Shumba. And so I shook her to see if she was responsive. I felt her chest to see if she was breathing. You can see in the video, luckily she is breathing. If you have time and you're still not sure, you could feel where the heart is. And again, that's the point of where the elbow meets the chest, or you can feel for a pulse. Next slide, I'm going to show you how we can actually look in their airway and make sure that it's patent. I couldn't get my model to lay still for this, so she is sitting up. So again, you can see that I have with my left hand, I'm pinching the sides of the cheek, and because she won't bite down on a gum, and then I'm using my other hand to pull down, and then again, you know, I trust her, so I was putting my fingers in her mouth. And the reason why you're doing that is just to make sure that there's no rawhide, there's no toy or anything that needs to be cleared out of their airway. I also recommend pulling their tongue out so you can really take a look at the back of their throat. Next slide. So how do you do chest compressions? We're going to talk about the different parts, which is patient positioning, hand location, compression depth, compression rate, posture, and compressor rotation. Next slide. And there's several factors that are important during chest compressions. And so one is to make sure that the backside of the patient is towards you and that your knees are against their chest. Doesn't matter which recumbency they're in. The other thing I'm trying to determine is what's the body conformation. And so I have a round chested dog. So I'm going to do at the highest point of the chest. And if you can see my posture, I have my elbows locked. I have one hand placed on top of the other. And I'm putting most of my pressure on the heel. That's the CPR pressure point. And my shoulders are directly over my wrists. And then I'm bending from the waist. And the reason why one does that, oh, she survived, she's alive. And the reason why you do that is if you bend your elbows and use your muscles, you fatigue really easily. But if you keep your hands locked and you bend from your waist, you're using your core muscles. And so you're better able to do it for a longer period of time. Next slide. So again, just to go through those in a little bit more detail. So pet positioning, again, most of the time it's with a pet lying on their side, but we will discuss some other situations where you might want them on their back. So there's certain conformations of dog, like your bulldog, which has more of a flat chest, which it may be preferable to do it similar to what we do in humans on their back. But the majority of our patients, we're going to be having them on lateral recumbency. I also recommend doing it on the ground. When one does it on cushions, on bed, you're not able to as effectively give chest compressions. And then also it helps if you can be kneeling by the patient, again, the back towards you. It can be on either side. And you just have more control of the patient. Next slide. And, you know, hand location, where you place your hands on your pet's chest during CPR is called the CPR push point. The location will depend upon the size and chest case shape, and we'll discuss that in a little bit more detail. And so again, for my pet, I put it on the highest point of the chest because she has a more dome-shaped chest. I'm trying to change the pressures within the thoracic cavity so that during compression, I can squeeze out blood out of the heart so it can go to the rest of the body. And then I make sure that I recoil and spring up. I'm not just leaning so that we can have blood coming back to the heart so that it's circulating. Next slide. So the best approach to compressions is we think of 4 categories of pet conformations based both on the chest size as well as the pet size. And I would recommend beforehand that you evaluate your pet so that you have an idea of where they would fit here, because you really do change the way that you do chest compressions. So for the first, medium to large dogs with keel-shaped chests, and that includes, for instance, greyhounds, and they tend to have a more in cross section, a more angular, triangular shape. And so typically in those breeds, because in those breeds you want to make sure that you're directly compressing the heart. The other category is medium to large dogs with round shaped chests. So my dog is an example of that, where they're about the same width and depth. And with those, again, the highest point of the chest. Dogs with flat shaped chests, like your bulldogs, your brachycephalics, those smush faced dogs, those are the ones that you're going to do on their back, or what we call in dorsal recumbency. And then with small dogs or cats, you can use chest compressions with two hands while you're pressing on the heart, but also you can use a one-handed technique, which I'll talk about in a little bit more detail. Next slide. So I just wanted to give you a view of my dog from the top. So in this first picture in the top right, this is how we measure the width of the patient, is again from the top, and then how we measure the height is on the side, going from top to bottom. So that gives you an idea of what conformation your dog has. And so we're going to practice. We're going to look at some examples of breeds. So next slide. So the different conformations are your keel shaped. And so again, classic example would be greyhounds, whippets, where they're a lot deeper than they are wide. And because of that, if you run your hands across their chest, it's almost like it's a ski slope. So it's gently sloping downwards. And for those patients, because there's not a lot of tissue between the heart and the chest cavity, we tend to have our pressure point be right over the heart. So if you take their elbow, put it to the chest, that's about a third of the way up. That's a good point to put your hands. In the middle, we have a classic bulldog, which we consider flat shaped. And so you can see that they're a lot wider than they are deep. And so for those patients, they naturally just fit on their back. And your hands will go on their breastbone, sort of between their armpits is a good location. And then for your typical round-chested dogs, like your Labrador Retriever, again, I have a Husky, they're about the same width versus depth. And with those patients, if you put your hand on their chest, it's almost dome-shaped. So if you come from the top to the bottom, you go from the front to the back, you'll feel like its highest point is in the middle. And so that's where you're going to put your hands. Next slide. This is a compression technique for small dogs and cats. And so what you'll do is you'll cup your hands like this. You want to make sure that you don't pinch, because if you pinch, you can actually affect outflow of blood. So you want to make sure that you're moving your thumb towards your hand, and also that your thumb is pointed towards the spine. And so typically you'll come around the breastbone. And again, typically they're in lateral recumbency. You'll use your other hand to support the spine, and then you'll do your chest compression. So works really well with cats and small dogs. What the cutoff is between medium-sized and large breed dogs and small animals is about 15 pounds or 7 kilograms is what I would consider when you're trying to switch between those techniques. The reason why a two-handed technique may not always be the best in these small breed dogs is it's so easy to put too much pressure and also to lean on the chest. And so that can really potentially cause some damage and also make it to where you're not administering high quality chest compressions. Next slide. As far as rate goes, ideal rate is about 100 to 120 chest compressions per minute. It helps if you can hum a song in your head to keep in beat. One of the classic ones is the Bee Gees song, Staying Alive, Staying Alive, Staying Alive. But the American Heart Association also has a lot of other songs on the playlist that one can use. I don't know if some of you are familiar with Baby Shark. That also made it on the list. And once that song gets in your head, it's hard to forget about it. And then with depth, it should be about 1/3 to 1/2 the width of the chest. It can be a little bit harder to achieve that in large breed dogs. And again, it's easy to overdo it in small breed dogs. It helps if you have someone there who's assisting you, if they can also critique you and kind of cross-check you and see if you're doing appropriate chest compressions. Next slide. Posture, consider 4 things. First is to lock your elbows. Next is to place the heels of the hand on top of each other. And you can either interdigitate or interlock your hands. And where you're pushing is on the heel of your hand. And your shoulder should be directly above your hands. And then again, you want to bend at the waist to compress the pet's chest. Next slide. Because it's really tiring if you're doing it properly, and if you have any help, it helps to have a new compressor take over every 2 minutes to reduce that fatigue, and it reduces the tendency to lean during compressions, preventing full recoil of the chest. So if you're able to set a timer on your watch, that's ideal, so that you know when you're ready to switch. And you want to make sure when you're switching compressors that you use as little time as possible. Next slide. All right, so we talked about chest compressions, and we spent a long time talking about how to do them most effectively, talking about pet positioning, hand location, compression depth, compression rate, and posture and compressor rotation. The other part of CPR is giving rescue breaths. And so in these patients, we do mouth to snout ventilation, and four steps for that. So you want to close the pet's mouth, extend the neck to open the airway so it aligns with the snout and the spine. And you want to make sure you do it flat. You don't want to lift up your pet's head or kind of move it in different directions, because that can kink off the airway. You make a seal over both nostrils and give 2 quick breaths. You want to watch the chest rise as you give the breaths, and each breath should be about 1 second. And you can have 1 second or 2 between breaths, but total it shouldn't take more than 5 seconds. Next slide. So this is me attempting to do mouth to snout on my pet. So we were hiking on the trail, and I was having Shumba do a demo, but I don't think she was having it. She thought it was kind of weird. But you can see again, I'm attempting to extend her head and give her a couple of breaths. Maybe you can see a little bit better here. So you can see that she's in lateral recumbency. I've extended her head so that she's parallel with her spine, and then given her a couple of breaths. So she's a good model, good patient model. All right, next slide. If you are the only person doing CPR, you perform a 30-to-2 technique. So you deliver 30 chest compressions, and I do think it helps to actually count out loud. And then you follow the chest compressions with 2 quick rescue breaths, again, not more than 5 seconds. And then you resume again another 30 chest compressions. And this is if you're a single rescuer. Next slide. If there happens to be 2 of you, then the person doing chest compressions, you want to administer 30 high quality chest compressions, counting out loud, and then a brief pause while your companion delivers 2 quick mouth to snout breaths. And you want to efficiently switch from compressor to breather after 2 minutes so that no one person fatigues. And so communication is really key, and sort of doing what we call closed loop communication. So whatever you communicate, the other person will say it back just to acknowledge that they understood what you've said. Next slide. All right, so that was a lot, but just to review everything with our CPR algorithm. First, you want to assess your pet for signs of cardiopulmonary arrest. So shake your pet, call their name out loud, put your hand on their chest, see if they're breathing, check the patency of their airway, make sure that there's nothing that's obstructing them. And this should take place in less than 15 seconds. Once you feel like they truly are in cardiopulmonary arrest, then you want to call for help and have someone get the car. In the meantime, starting CPR and giving 30 chest compressions using the technique that we mentioned before, administering 2 quick breaths, and then repeat the cycle. You want to load your pet in the car and then continue CPR while you're transporting your pet to the vet. And definitely the sooner you identify that a patient has arrested, the sooner you initiate CPR, the more likely you are to have a positive outcome. Next slide. And again, this is the algorithm, and I'd recommend printing it out and having it available or visible in a location. The other thing is you could download it to your phone too, and that way you could easily pull it up just to make sure that you're following sort of the CPR algorithm. And then lastly, I have put together some resources that I think would be really helpful if you want to continue your learning after this presentation, and again get a little bit more advanced training through the Recover initiative. So doing their online module as kind of a first step, and then actually being certified as a rescuer through a simulation session. And I'm happy to take any questions at this time.
Perfect. Thank you so much for your presentation. We do have some questions. I'll start with a question that came in. The viewer asked, is there similar damage to a pet's cartilage and ribs when you do CPR like there is in humans?
Yeah, no, good question. My sister's in the human health care field, and she's a doctor, and she's talked about when she's done CPR that she's broken ribs. I have to say, I feel like it's less common that I've experienced that. And I don't know if part of it is just because our pets have more compliant chests. So I feel like their bones aren't as brittle, maybe as human beings. So I really don't think that I have caused any rib fractures that I know of. I definitely have caused some pulmonary contusions, which means bruising to the lungs. So not surprising, again, the force that we're kind of putting on the chest. But usually those can resolve. So let's say if you bring the pet back, just giving them supportive care. But yeah, good question. Other questions?
Yeah, we had some more come in. One question is, when is the best time to break CPR and move to the car? Like, how many breaths should you give, and kind of walk us through that scenario if you can.
Yeah, good question. And definitely minimizing interruptions is ideal, or interruptions to your CPR. I think as much as possible, the person who's actually doing the chest compressions, giving the breath, if they can just be focused on that, and then being able to have the person who's helping, a lot of times, hopefully there's someone there around who can help you with that. Otherwise, again, it's trying to call a friend or a neighbor so that they can come and be able to help you load the pet. And then what's important is your safety too. So whoever's driving needs to be just focused on driving, and then whoever's in the car doing CPR. So I think thinking about the safety of everybody, and then trying your best to have everything ready to go, right? So is the car as close as it can be? Do you have anything that you can actually transport the pet in as quickly as possible? A suggestion I might have, because I know people don't have stretchers at home, is you could lay a blanket, right? And you could roll the pet in the blanket, and then you can lift it up and then carry it into the car. So as much as possible, minimizing the interruptions to chest compressions. But I also think the sooner you get to a vet clinic, the better. One of the resources that I've provided for you guys is there's an app. It's called FURst Aid. It has a lot of great resources, some of the things that I talked about, as well as common toxicities. But I also like how it's got numbers of, so you can easily, based on your location, see what's the closest emergency clinic is, and how to get there. They even have like pet hotels too. So I think that's really helpful resources. Another suggestion is maybe role play, right, with your family members if something should happen, because I always think preparedness is so important. Us on emergency, we often kind of, in essence, think the worst, right? So that we're prepared. So when it does happen, things are a lot more smooth. We have things in place. We've kind of anticipated what might happen. And so I kind of recommend the same thing too for our pets.
Perfect. We had a couple of questions come in relation to kind of the small dog / cat. The question, I guess, is could you maybe kind of demonstrate that again? And then in your example slide, the Chihuahua was standing. And so the question is, why that versus lateral or laying on the side? So maybe go over that real quick.
Yeah, absolutely. And my model for that would not lay on her side. So ideally you want to be on the side because they won't be standing. I just showed you guys for demos purposes. So, with that, you want to cup your hand like this. And again, they're going to be on their side. If I could just stand up and show you. Shoba, can you help me? Come on. Are you sleeping? She's sleeping. She's tired out. I wore her out this weekend. So what you can do is cup your hands like this. Again, they'll be in lateral recumbency. So pretend this is their breastbone here, and this is their back. So you're going to use your non-dominant hand to support their back while they're on the ground. Have this cupped around their breastbone, and your thumb will be right on their heart. So again, remember the heart is where the elbow meets the chest, about 1/3 of the way up. So that's a perfect location. And all you're doing is this motion here. You don't want to do this pinching motion because that obstructs blood flow. You want to more bring your hand towards your other hand so that you're compressing the heart. And then typically the thumb is pointed towards the spine. So you're doing this movement here. It can be very tiring after a little bit. And so sometimes I switch between single rescuer and double rescuer. Say one-handed versus two-handed approach.
Excellent. A couple other questions kind of on a similar vein to each other. One is, when is it too late to initiate CPR? And then another question that came in is, what are the statistics on how often CPR works and is successful and those kind of things? So.
Yeah, good question. I think the sooner that you initiate CPR right when they've gone into cardiopulmonary arrest, the better. Even after 5 minutes, there's already damage being done to your organs. And if you don't have, blood flow, then soon there's going to be irreversible damage. So again, depends on how quickly you identify that your patient has collapsed. I think as far as survival goes, and unfortunately, most of the statistics we have are in hospital. So overall survival from or discharge, return of spontaneous circulation and discharge is probably about 4 to 9%. And it varies a little bit cat to dog. If it's related to anesthesia, for instance, it's definitely a better outcome. So we say even up to 47% chance of return of spontaneous circulation and them being able to go home. Out of hospital arrests, unfortunately, we don't have a lot of information with that. I think, you know, with Recover Initiative, and they published their results in 2012, I definitely have seen a change in the veterinary community as far as comfort with doing high quality CPR, improvement in communication, debriefing, and then just functioning as a team. And so I would be curious in subsequent studies if we're noticing sort of an improvement after the, you know, after they started this this Recover program. And I think as far as, you know, pet owners, I think as there's more awareness, and again, more people are getting this training and feeling comfortable, I wonder if, you know, we may, again, be able to save more lives.
Thank you. We had quite a few questions come in about kind of which category certain breeds of dogs fit into. Maybe you could just do a quick refresh on kind of the different sizes and which breeds might be examples of those.
Yeah, definitely. So I'm going to see if I can get Shumba to help me out again. All right, so one way to see sort of where your dog fits is to look at them from the top. And so you want to see how wide they are. So this is the width, and then compare it to what their depth is. So if it's about the same, they are more round-chested dogs. The other thing you can do is if you lay them on their side, what is it? Such a good girl. So you can take your hand and you can go from the front to the back. You can go from the top to the bottom. And you should feel that it's kind of dome-shaped in the middle. So this is a round-chested dog. Some examples would be Labrador retrievers. Now, in more keel-shaped dogs, so think of your greyhounds or your whippets, with those patients, if I were to do the same thing, it would be a gentle slope downwards when I'm doing that. And when I look from the top, they're really, really narrow, and then their depth is quite, you know, quite deep. So they're deep-chested dogs. And so for those patients, we would go more on top of where the heart is. So if I take the elbow, pull it a third of the way up the chest, that's going to be my CPR push point. And so that's where I'm going to do chest compressions in those keel-shaped dogs. With a dog like mine that's more round-chested, where again it feels more dome-shaped, I'm going to go at the highest point of the chest, so more in that area. Other breeds of dogs, like if you think of your bulldogs, so with your bulldogs, they're really, really wide. So if you look at them from the top, you know, they've got those broad shoulders as well too. And they tend to be really, really not very much depth. So we call them barrel chested. It's actually very similar to us people, right? We don't have very, if you look at me from the side, I don't have very much depth, right? But I'm a lot wider. So that's why in people, we do it on the back. And so with those bulldogs that have what we call flat chested, we're going to do it in dorsal recumbency. So we're going to more do it here. But you can see in a dog like her, she's not going to stay very well, right? She's definitely going to fall over to the side. And then I can demo for the small patients. Again, put the elbow at the chest here, take my hand like this, put it around the breastbone here, and then push on there. And that's a one-handed chest compression. You can use two-handed in these small dogs, but you have to be careful that you're not pushing too deep, because you only want to push it 1/3 to 1/2. So this is the depth. You only want to go about that far when you're pushing down the chest, and you want to make sure it springs back, that you have that recoil. Good girl. You're a good girl.
Excellent. Thank you so much. What a good dog. Everyone's loving the demonstration there. So that was perfect. We're going to go ahead and wrap up here in just a second. Just real quickly, as some people are signing off, we will be sending out a follow-up email with a link to the recorded presentation as well as the resources. And we've also provided that information in the chat where you can access the web page where we'll also make this presentation available there. So just wanted to shout that out real quick as people are dropping off, as I know we're at our time limit, but a couple more real quick questions. There were several that asked, is there a Heimlich maneuver for pets? And if so, kind of how do you do that? So that will be our last question. And then I'll provide my information in the chat and you can reach out with further questions to me and I'll do my best to get back to you. So.
Yeah, so you can do the Heimlich maneuver, probably a little bit different in pets than in people. So it may not do so much for, you know, in people, how we go from the abdomen. And what you're trying to do is generate increased pressure so that you can expel whatever might be lodged in their throat. With dogs, I would probably do more the highest point of their chest and then again, put a lot of force and then hopefully that would be able to expel anything that's lodged in the back of their throat. So again, I think it's reasonable if when you're checking their mouth. So again, I take my non-dominant hand, I pinch the cheeks here, and then I pull down with my other hand, and then you can put your hand in there and be able to see if there's anything in there, or if they're not responsive, you can actually pull out their tongue and then be able to move out whatever's in the back of their throat.
Excellent. Well, thank you so much. I'm going to share my screen real quick with a few slides just for contact information and resources, and then we're going to close the webinar. Thank you all for joining us. Thank you, Dr. Wanyama, for the great presentation, very informative, and I'm sure we'll have some follow-up questions for you that I'll try and circulate, and we'll get some answers back to folks. So again, thank you all for being here today, and I'm going to share my screen here.
Bye. Thank you.
Okay, so if you have patient-specific questions or a need of services, you can access us here at the Lois Bates Atchison Veterinary Teaching Hospital in our small animal clinic, as that's the theme for today's presentation, was for cats and dogs. That's our phone number there and the email. Like I said earlier, my name is Jens Odegaard. I'm the Director of Marketing Communications, and our Director of Development, Anna Justice, was also helping us out in the chat today. So if you would like to get involved with the Carlson College or are looking for ways to learn about other opportunities, feel free to give us both a shout out, either via our email or our phone. Our future FURst Aid events and the recording of this presentation will be made available at vetmed.oregonstate.edu/FURst-Aid. And our next event is planned for April. We'll be following up with specific dates and times, and that will be wilderness safety with Dr. Brianna Beechler. So wilderness safety for your pets. Finally, you can follow us on social media, and to ensure that you get invited to the next FURst Aid event, sign up for our Vet Pulse e-newsletter, and we'll have all the details going out there. We send a monthly e-newsletter out to folks who've signed up, and we also make sure to include information on special events like this. Finally, thank you all for joining us. I'm going to stop my video and hit mute, and I'll try and drop a few other resources in the chat if needed. Again, thanks for joining. Take care.